Hello everyone, I am Dr. Lipy Gupta and today we will be discussing about hair fall. A head full of hair is something which every one of us wants in today's world, and the hair fall is becoming a growing concern in today's world. We do have a large number of patients who visit us which complain of excess hair fall. These patients are both young men and women, and in fact in many of the cases we also have young children who come to us for this problem. So first of all, I will like to discuss that what can cause hair fall. Hair fall can be caused by a lot of problems. These can include medical problems like thyroid. Both hyper and hypothyroidism has been known to cause hair fall. Anemia, deficiency of vitamins, stress, hormonal changes like polycystic ovarian syndrome, all of these things can trigger hair fall. Besides this, excess hair procedures like hair straightening, hair coloring, hair rebonding, all of these have also been linked to increased hair fall. Some women also complain of excess hair fall, especially after childbirth, which is generally supposed to settle down within a year, but sometimes it can continue for even longer. Besides this, hair fall can also happen as a result of certain medications, chemotherapy, certain injections which are given for treating other medical problems. Hair fall has been associated to be genetic in many cases, especially when it is a patterned hair fall. Besides this, there are certain causes which can cause scarring hair fall. In these cases, there can be some infections on the scalp and many autoimmune conditions in which leads to scalp infection and the hair follicles heal with scarring. As a result of this, there are bald patches which are created on the scalp. Now sometimes we have patients who ask us that what is the normal hair fall which is acceptable. One can lose up to 100 to 150 hair follicles in a day while combing or during washing of hair. So up till this level the hair fall is normal. So if one complains or that I am losing 20 or 30 hair follicle strands in a day, this is very much within the acceptable range. Another common questions which patients ask us is, why is hair fall so seasonal? Whenever there is a changing season from transition to summer to autumn, or whenever there is a sudden change of temperature and moisture, sometimes we have patients who ask us that what is seasonal hair fall? Whenever we have a changing season, the hair are more in a resting phase and then they have a tendency to fall suddenly. This is seen more commonly when there is a transition of seasons from summer to autumn or from winter to autumn. The hair follicles which are in a resting stage, they shed and that is noticed as the patient as a sudden hair fall. Another common question which patients ask us is, what are the diet which we can take to reduce hair fall? A balanced and a healthy diet is key to have a good hair. So we have a diet which is good in dairy products, in proteins and vitamins. All of this will help to improve hair strength. Diets which contain good amounts of vitamin B12, folic acid, proteins, omega-3 fatty acids, zinc and vitamin B7 which is biotin will help you to maintain your hair healthy and strong. When we see women who have a sudden dieting and who are losing weight, we also notice that these women complain of hair fall. So when you are losing weight, there is a negative protein catabolism in your body and you tend to lose hair suddenly. Therefore, we would advise such patients who are losing weight to maintain a balanced diet so that they don't complain of a sudden hair fall. Another common advice is what you can generally do to maintain good hair is have a balanced healthy diet, avoid bad habits like smoking and alcohol, eat and drink healthy, avoid junk food and high calorie foods, and have concentration more on foods which are rich in vitamins and proteins. Besides this, maintain a healthy lifestyle, exercise, do things like yoga and meditation because this is going to reduce your stress levels. Now I am going to discuss that how do we approach a patient when the patient comes to us with hair fall. We take a complete history to find out what the cause of hair fall is. That includes the history of medications, stress, any associated medical illnesses, genetic history, because in pattern hair fall, especially both in women and men, we do have a positive family history. After this, the necessary investigations, which include a hair assessment, investigations which include vitamin B12, vitamin D3, iron and thyroid are checked, and we prescribe medications. Now the medications which are prescribed for hair fall are both oral as well as for application. The oral medications are generally containing biotin and vitamin supplementation. The topical medications are either vitamin solutions or medications which contain minoxidil with or without combination with finasteride. Topical minoxidil shifts the hair follicle from a falling to a growing phase, and after its use we have more follicles in the growing phase. The follicles are shifted from a falling to a growing phase over a period of 4 to 6 weeks. So the effect of this medicine can only be assessed after a period of 2 to 3 months. Besides this, now we have some procedures like platelet-rich plasma, mesotherapy, and injection of certain growth factors which can be performed to improve hair strength and decrease hair fall. Today I will be discussing about platelet-rich plasma, which is a common treatment which we perform at a clinic to improve hair fall patients. Platelet-rich plasma uses the energy and the strength which platelets have, which are injected into the scalp after the blood is withdrawn from the patient. The blood is processed and the platelet-rich fraction is extracted from it. This is injected when a topical numbing cream or a numbing solution is applied on the scalp to numb the scalp area and to make the procedure comfortable for the patient. These days we have a wide range of PRP tubes which are available, and for best results for the scalp we can use biotin containing tubes. These biotin containing tubes are available in the market. There are also tubes which contain plain ACD and heparin. Depending on what indication we are using PRP for, we can choose the kind of tube. We open a sterile tube, and after this the blood is injected inside the tube. And after the blood has been taken, it is placed in the centrifuge machine. After centrifugation, we can see PRP has been prepared. There is a platelet-rich fraction and a lower fraction which contains the RBCs. The platelet-rich fraction is transferred from the tube into sterile 1 ml syringes, which is then further injected into the scalp. The scalp is prepared by spraying a topical numbing solution which helps to numb that area where the PRP will be injected later on. The numbing spray is kept for 15 to 20 minutes for best results. The PRP which is prepared is transferred into 1 ml syringes and is then injected into the scalp into areas of thinning. After the medicine has been injected, the results are further enhanced using derma pen which has a disposable tip. This procedure is done all over the scalp and is supposed to enhance the results of PRP. Not only it helps in better spreading of the PRP solution, it also helps in improved blood circulation so that the results of PRP are enhanced. It's a simple procedure which is performed as an outpatient procedure. The procedure time is generally around 60 to 90 minutes. The procedure needs to be performed once every month for at least 3 to 4 months to see a visible result. The immediate effect of the procedure takes around 2 to 3 weeks, in which we can see a reduction of hair fall and improve in the hair texture. However, it takes around 3 to 4 months to see a visible result which can be appreciated.